Hi, I'm Carla. I'm from Fort Wayne, Indiana, and I'm 47 years old. It took me 30 years, 6 doctors, and 1 nurse practitioner to reach my diagnosis of alpha-1 antitrypsin deficiency. I had a lot of shortness of breath with running, and I noticed that I couldn't keep up with my friends. I experienced more shortness of breath, that I reverted back to my little kid mind and convinced myself was my weight. I just told myself, if you want to breathe better, lose weight and quit smoking. The doctor's office had called and told me that I needed to go to the emergency room because my lung was collapsed. So while I was in the hospital recovering from my collapsed lung, I met a nurse practitioner who asked me a series of questions about my medical history and recognized them as symptoms of alpha-1 and asked me if I'd ever been tested and then recommended testing for me. I would have never been tested for alpha-1 if that nurse practitioner hadn't seen me that evening. When the pulmonologist came into my hospital room to tell me that I had alpha-1 antitrypsin deficiency, I was alone at the time. And she came in and she said, "I have news for you. You have alpha-1 antitrypsin deficiency." I asked her what that was, and she said that it was a lung condition. She said that I was terminally ill and that there was no treatment for it except for a lung transplant. And the first thought that crossed my mind was that I have a 9-year-old at home. Thankfully, I found a lot of information that pointed in an entirely different direction than what she had given me. I certainly found that people with alpha-1 antitrypsin deficiency often have transplant, but they often live lives after they're diagnosed with it as well. And so at 38 years old, I didn't feel like that was the last day of my life. When I walked into the pulmonologist's office for my 1-month follow-up, I thought that we were going to be having a conversation about what I needed to do to be ready to transplant. And so when I found out that she was prescribing augmentation therapy, I was very excited about that and very willing to try. I'd really encourage screening for alpha-1 as part of a complete COPD diagnosis. In the years since I was diagnosed with alpha-1, I've learned that COPD is very different from genetic COPD, and that there's a stigma attached to COPD in which they think that you've been a smoker. And while that was true in my case, it's not true in everyone's case. If you're a healthcare provider and you're not screening people with COPD and with the other symptoms of alpha-1 for alpha-1, it's a simple test. Why not get an answer, even if it's a negative answer, even if they don't have alpha-1, at least you've ruled it out. But if they do have alpha-1, you may have changed their life. Since I've been diagnosed and started treatment, I really feel like I have a whole lot of life left to live and to do some crazy things that I had never really considered before.